Good evening, my people. We are still continuing with our online education, and may I start by thanking you people for the support you are showing. Thank you for the subscriptions, thank you for the likes, thank you for the comments also, and those who are coming up with topics we discuss, I also appreciate. So let's continue encouraging our brothers and sisters to continue subscribing, liking and sharing our videos so that they may reach as many people as possible. The topic of the day is a very important topic people have been asking about, and we will be talking about adenitis. What are adenitis? If somebody puts you this question across your face, what is adenitis? What will you answer? So, adenitis is a general term for any inflammation of a gland. So, any inflammation of a gland can be termed as adenitis. So, adenitis is a term for an inflammation of a gland and often used to refer to lymphadenitis, which is an inflammation of a lymph node. An example of a lymph node is what we call tonsils. It's a lymph node, which their main function is to fight the body against bacteria, virus, and also fungus, or are involved in immune system improvement or defense of the body. So, lymph nodes are a collection of tissue found throughout the body, responsible for filtering bacteria, virus, and waste products of blood. What are the classifications of adenitis? They are classified according to where they are situated or where they are found in your body. Lymph node adenitis. Let's start by lymph node adenitis. Lymph node adenitis or lymph node adenitis is caused by an infection in lymph nodes. Infection in the lymph nodes. Infected nodes become enlarged, warm, and tender. A swelling of lymph nodes due to growth of lymph cells is called lymphadenopathy and includes, number one, if it is situated around the neck, we have cervical adenitis, which is an inflammation of a lymph node in the neck. Tuberculosis adenitis or scrofula is a tuberculosis infection of the skin of the neck caused by Mycobacterium tuberculosis, which is a bacteria. So let's talk about what if the lymph nodes are situated at the abdomen. So we have what we call mesenteric adenitis, which is an inflammation of the mesenteric lymph nodes in abdomen caused by Bacterium Yersinia enterocolitica. If it occurs in the right lower quadrant, if it occurs in the right lower quadrant of your body, it can be mistaken or confused for an acute appendicitis and often preceded or before it comes up, you usually have a sore throat. Clinical manifestations may include, or it might present with fever, right lower quadrant abdominal pain, nausea and vomiting. It often occurs between ages 5 to 14 years. 5 to 14 years. So we have other forms of adenitis, and for example, we have what we call sebaceous adenitis. Sebaceous adenitis. Sebaceous adenitis is an inflammation of the sebaceous gland. The sebaceous gland is found on the skin. So it's an inflammation of the sebaceous gland in the skin. The gland produces sebum. The gland produces sebum, which is also called skin oil, which is a lipid-rich secretion. A lipid-rich secretion which prevents the skin from drying. So, if you lack sebum in your skin, or when the sebaceous gland is affected, it will not be able to produce the lipid rich secretion or the sebum, which is responsible, or which its main duty is to lubricate your skin or make the skin the way it is, or improve the skin tartar and avoid avoid drying of the skin. Because when the skin becomes dry, it will start cracking, and the cracks will cause some discomfort and pain, and also it will create entry for bacteria into the skin. This marks the end of our first video. Let's continue subscribing, liking our videos, and today we are doing it a bit late. So what is important is getting the information. So let's keep the support on. Let's continue subscribing, liking and sharing our videos, and keep the support on. Have a good evening, and let's meet in the next video, whereby we'll be talking about the same topic.